When we talk about scars, what we mean is it's something visible or kind of distorted. Technically, when you have an incision, you always have a scar. But if a tissue has tension on it, it's going to give a noticeable scar. So you can see facelift scars if you know where to look for them. The area that's the most distorted is right in front of the ear. And a lot of people know that if you look in front of the ear or in back of the ear, you might see a facelift scar. Scars will improve over time, but the scar will always be present. It goes through some color changes. In the beginning, it's a little red because it has extra blood flow, and then it starts to fade out. And at the end, hopefully you'll have pigmentation that matches the other pigmentation. If there's a little faded area because of loss of pigmentation, it's going to be more noticeable. That's why if you can avoid a scar, it's always the best. A traditional facelift involves an incision right by the sideburn area, in front of the ear, around the ear, and back in the hairline in the ear. I recently did a presentation where it's shown that that's about 70 centimeters. If you do a non-traditional facelift, what I call a no scar technique, then you can hide incisions and it's only about 7 centimeters. So it highly depends on the type of facelift that you have is where the scars are going to actually be. After a facelift, the wound will go through a wound healing mechanism. And whether you have a 1-inch incision or a 10-inch incision, you still go through the different types of wound healing. The wound will be a little pink in the beginning, and then it'll start to fade, and it will actually look its best at about a year. The reason that most doctors don't recommend any further enhancements or touch-ups or adjustments for at least 6 months is because of the scar maturation process. So everything does look better with time. If you have an unsightly scar, that's a different situation that could actually look worse over time. So the real key is a facelift that has either good scars or has hidden scars. Obviously, a hidden scar in the hairline or in the hair is always better than a visible scar. Please make sure to subscribe. The goal of an excellent facelift is to be able to put your hair up and wear it that you cannot see the scars. Unfortunately, with a traditional facelift, you have distortion of the earlobe and you have scars behind the ears. So you want to try to find a surgeon that does an advanced approach where you can wear your hair up and not see any scars. That's not typical, but it is available. A deep plane facelift is a facelift that goes right to where the attention is causing all the aging. It's like that old joke, I think it might have been Willie Sutton's, like, why do you rob banks? And he's like, well, that's where all the money is. It's the same thing with a deep plane facelift. Back here is skin, but here is where all the action is. So a deep plane facelift goes over here and then dives under the deep area. The only challenge with it is you have to really know the advanced anatomy and have a lot of skill, because technically it's a little more difficult. If you look at the statistics, about 97 to 98% of facelifts done by surgeons in the US is what's called a SMAS, S-M-A-S facelift, which is not a deep plane facelift. So a deep plane facelift gives the smoothest, best results. And the reason it does is the skin and the fatty layer underneath don't get separated. With the traditional facelift and a SMAS tightening, you separate the skin from the fatty layer, and so you disrupt that vascular plexus So if you disrupt the vascular area, you're going to have more trouble healing. So deep plane is definitely the way to go, and that's what I would certainly do if I was operating on a family member. A deep plane approach traditionally involves making an incision in front of the ear and going over in the skin area and then going deep into the facial tissues. With newer, more advanced techniques, you can actually do all of that endoscopically, and through an inside-out approach, you can loosen the ligaments through the mouth area so there's no scar. And I can come in through the hair area where again there's no scar. So you literally have no scar in front of your ear and no scar in back of your ear. The most natural looking facelift is where you take your tissues that have changed primarily because of gravity and we put your own tissues back where they belong. To do that, we have to release some facial ligaments. Then we have to recontour the face, and then we have to anchor it and set it in place. So the best thing to do is really to release the tissues, to recontour, and to reset. And you want to do that with the least amount of incision sites so therefore you don't have an external scar. If you approach things from the inside out, you can do 85% of the work from the inside tissues so you do not have a scar. And in my opinion, that's the best way to do a facelift. The facelift of today is not the facelift that your mom and your grandmother did. People are having it done younger and younger because we've been able to see with anatomy, the younger that you have a procedure, the more natural it looks and the longer it lasts. It used to be facelifts lasted 5, 8, maybe 10 years. Now they can last 20 years, 25 years because people are doing it younger. It's kind of what we have termed prejuvenation instead of rejuvenation. Sometimes you don't wait and have this one big facelift and it's noticeable, and we've all seen people where you kind of say, wow, do they look different? And hopefully they look better, but a lot of times they only look different. If you have it done earlier, it looks more natural, it lasts longer. So I have people that are having facelifts routinely in their 40s, and that's actually an ideal age to do it, 40s and 50s.